Hi everyone, welcome back to channel. In today's video, we're diving into Risperidone, a powerful medication also known by its brand name Risperdal. It's commonly prescribed to help manage conditions like schizophrenia, bipolar disorder, and irritability related to autism. Risperidone works by balancing certain brain chemicals that influence mood, behavior, and thinking, helping many people feel calmer, more focused, and emotionally stable. Before we begin, please remember this video is for educational purposes only. I'm not a doctor, and this shouldn't replace professional medical advice. Always talk to your healthcare provider before making any changes to your treatment plan. In this video, we'll explore the 7 major effects of Risperidone, including how it helps, the common side effects, and some surprising things you should know. Whether you're taking it yourself or just learning, this guide will help you understand Risperidone more clearly. Effect number 1, calmer thoughts, and AMP, better focus. Risperidone works deep inside the brain, helping to balance key chemicals like dopamine and serotonin, the messengers that shape mood and perception. For many people struggling with racing thoughts, paranoia, or hearing voices, this balance brings something they haven't felt in a long time: peace. The mind slows down. The noise fades. Confusion starts to clear. It doesn't happen overnight. Sometimes it takes days or even weeks. But when it does, life begins to feel more manageable. Simple things like focusing on a conversation, following a routine, or sleeping through the night become possible again. Risperidone doesn't erase thoughts. It helps organize them. For people who've lived in chaos or fear, that calm can feel like a quiet miracle. Effect number 2, drowsiness and AMP, slower energy. Risperidone has a strong calming effect, and that can make you feel tired or sluggish, especially in the first few weeks. Many people notice they start sleeping deeper and longer than before. For some, that's a blessing after months of insomnia or restlessness. But for others, the drowsiness can spill into the day, making it hard to focus or stay energetic. You might feel like your body and brain are moving a little slower. Doctors often recommend taking Risperidone at night to minimize that heavy daytime fatigue. Over time, the body usually adjusts, and the tiredness becomes more manageable. Still, it's important to find the right balance, enough calm to feel stable, but not so much that you lose your spark. Effect number 3, weight gain and AMP, appetite increase. One of the biggest challenges with Risperidone is weight gain. The drug can increase appetite and change how your body stores fat and sugar. You might start craving snacks or feel hungrier than usual even after a full meal. For some people, it's a few pounds. For others, it can be more noticeable. It's not about willpower. It's a chemical reaction in the body. That's why simple habits matter so much: staying active, choosing lighter meals, and keeping track of weight regularly. Some people find walking daily or limiting sugary drinks helps a lot. Remember, your goal isn't perfection, it's balance. Managing mental health and physical health together is part of the journey, and both deserve care and attention. Effect number 4, hormone changes, prolactin levels. Here's something most people aren't told at first. Risperidone can raise a hormone called prolactin. It's the same hormone involved in breast milk production. When it rises too much, it can cause symptoms like missed periods, breast tenderness, or even unexpected milk production in both men and women. It sounds shocking, but it's more common than you'd think, and usually reversible. Once the dose is adjusted or the medication is changed, the hormone levels often return to normal. If you notice physical changes or anything that feels off, don't ignore it or feel embarrassed to bring it up. Your doctor has heard it all before, and small adjustments can make a big difference. Awareness is key here. Knowing what's happening in your body keeps you in control. Effect number 5, movement or muscle effects. Because Risperidone affects dopamine, the same chemical that controls movement, some people may experience stiffness, trembling, or restlessness. You might feel like your muscles are tense or like you can't sit still for long. These effects can be unsettling, especially if you don't expect them. But the good news is, they're usually manageable. Doctors can adjust your dose or prescribe a small add-on medication to calm these sensations. The key is not to panic or stop the medicine suddenly that can make things worse. Most people find these effects fade or improve with time once their dose is balanced. It's one of those side effects that teaches you to stay in touch with your doctor and report even the smallest body changes early. Effect number 6, emotional stability and improved sleep. One of the most positive effects of risperidone is emotional balance. For people who've struggled with mood swings, anger outbursts, or constant anxiety, this medication can help bring a steady calm. It can also improve sleep, not just by making you drowsy, but by quieting the mind so rest actually feels peaceful. You might find yourself reacting less to stress, feeling less overwhelmed, and getting along better with others. Over time, this emotional steadiness helps rebuild relationships and confidence. But there's a fine line. Too much calm can start feeling like fatigue or numbness. That's why getting the right dose is so important. It's about finding your center where you feel calm, but still alive inside. Effect number 7, blood sugar and cholesterol changes with long-term use. Risperidone can slightly raise blood sugar and cholesterol levels. It's one of those silent effects that doesn't cause symptoms right away. Over time, though, it can increase the risk of diabetes or heart issues if not monitored. That's why doctors usually check your blood work every few months to catch any changes early. If you already have diabetes or high cholesterol, it's even more important to stay on top of it. A few lifestyle tweaks, like balanced meals, light exercise, and enough water can go a long way in protecting your health. Remember, the goal isn't fear, it's awareness. When used responsibly and monitored carefully, risperidone can transform lives while keeping you safe. So, those were the 7 big effects of risperidone calmer. Thoughts, drowsiness, weight changes, hormone effects, muscle issues, emotional stability, and sugar or cholesterol shifts. Used correctly, risperidone can be truly life-changing, helping people regain clarity, control, and calm. But it also needs respect and regular check-ins with your doctor. Never stop suddenly, and don't be afraid to ask questions about what you feel. The more you understand your medication, the more power you have over your mental health journey. Thanks for watching Stay Informed. Take care of your mind and body, and don't forget to like, comment, and subscribe for more simple, clear medical explainers.